Hi, I'm Dr. Chuck with another Metabolic Minute. Dr. Chuck Meekin of Meekin Metabolic Care. And I want to leave 3 points on the table for you on how to speak to your oncologist regarding new treatment plans, new courses of therapies, new clinical trial opportunities, and so forth. And first of all, you want to ask him or her to always give you the potential benefits in absolute numbers, not relative risk reduction or relative risk factors. For instance, you can have like a 35% relative risk improvement in median survival. And if you look at the absolute numbers, the NNT, the number needed to treat, you might have to treat 60 people to get that one benefit of that improved survival. So by putting it in the NNT, you as a customer, as a patient, can better size up, is this going to be good for me? Most of the time patients say, well, if it helps 1 in 5 or less, that might be something to look at. But if it's more than 1 in 15 or 1 in 20, maybe that's something you want to stay away from. So ask about the NNT in absolute numbers. Number two, you want to also ask about the NNH, number needed to hurt, the opposite of that. How many people get grade 3 or 4 side effects on that treatment? Or does anybody die on that treatment? What is the mortality rate? And so you want to know those big numbers because sometimes that will give you the sort of calculation of the net benefit. If the NNH is greater than the NN2, you know you're really gambling to do a treatment and get a benefit out of it. And then finally, beyond the NNT and the NNH, you also want to ask about what I call the hassle factors. That's the third. The hassle factors are, okay, if I'm going to do this treatment, am I going to have to leave my home? How much time am I going to spend in the office? Because the time in the office is not time me doing what I want to do. Number three, how much time am I going to have to fight with insurance companies for this new treatment? I know new treatments sometimes, they're not embracing those and they usually cost a lot more. Commonly, I see, when drugs come off patent, there's a slight improvement with a new drug, but those are all now $20,000 to $30,000 a month, and you're going to have to deal with that insurance issue and possibly pay out of pocket for that 20% or whatever your component is. So always ask about the hassle factors. I always remind patients when you have to leave home and go to maybe a different city to get your treatment, you're not in your tribe of people you want to hang with. You don't know the exercise options where you are. You maybe aren't eating as well as you could be because you're in a hotel room. All those come to play and they can work against the potential benefit. Well, anyway, remember those big three when speaking to your doctor. I'm Dr. Meekin, Dr. Chuck, Meekin Metabolic Care. That's all I got. Good luck.